I think we are good to start. So, good morning, good afternoon, good evening, and namaste. I'm Pramod from India, JSI. Uh, so, thank you for joining in the community activation dialogue series, episode 2. And the theme of this webinar is effective communication for polio vaccine acceptance. And we are 4 team members who have tried to bring this webinar to you. And so let's have a look at the logistic part. Can we have next slide, please? So I would request everyone to kindly mute yourself to limit any background noise and feedback. You can use the reaction button at the bottom of your screen to raise your hand, and during the session, you can also engage in dialogue with your peers over here and facilitators through the chat at the bottom of your screen. Can we have next slide, please? So walking through the agenda, we have 4 thematic areas which we are talking about. So we will begin with the polio vaccination and its acceptance. Then we have a storytelling session on vaccination journey. Then we have a interpersonal communication influence on polio vaccination and its acceptance. Followed by a field testimonial, and then we have an open Q&A session where you can share your thoughts, views, and your contribution on this webinar. Yeah, next slide, please. Setting up the theme. So globally, there has been emergence of polio cases that threatens the advances that has been made over the past 3 decades. So last year, we have a case detection of white polio in Malawi, and in the recent month, in the month of May, we have in Mozambique. And the fact is that the white polio is not only the concern. We have seen a rise in what we call the vaccine-derived polio outbreaks, which are happening due to the gaps in community-led immunization. And we all know that we are still navigating the COVID-19 pandemic, which have already caused heavy disruption in healthcare services, including immunization. Yesterday only, I was going through a data which was released by WHO and UNICEF 3 days back on 15th of July, and which stated that 18 million children did not receive a single shot of vaccine in 2021, which has not happened in the last 29 years. So almost 3 decades we have been not seen these single shot vaccine. So you can see how much COVID-19 has disrupted the immunization service. So on this note, I think it's a high time to activate the community, to create the demand generation, to mobilize the community, and to increase the coverage of polio vaccination. So can we have a next slide? So for all of this, effective communication is a key enabler. And on this note, I would like to introduce Dr. Ganguly. Can we have next slide of speaker? Dr. P.S. Ganguly we have with us. He's a current project director for the Rapid Immunization Skill Enhancement, JSI India. He's a former professor and registrar at the Institute of Public Health, Indian Institute of Public Health, Gandhinagar, and he has been associated with WHO at various capacity, and he will be sharing his views and his perspectives and aspect around the polio vaccine acceptance. So I would request Dr. Ganguly to share his talks with us.
Hello and namaskar. From India, I am Partho Ganguly. Thanks, Pramod, for the nice introduction, and really happy to be part of this platform today to discuss about the polio vaccination and the role of communication. It is just by a coincidence, you can say, that I got the chance to be associated with the polio vaccination drive in India for more than 2 decades. From the very beginning, when the polio vaccination started in India. That was way back in 1995-96. I was just a young public health professional at that time, just out of the universities. And since then, I had been in different capacities, been part of the polio vaccination. And it gives me immense pleasure that today India is polio free for last so many years, no wild polio virus. Of course, the chance of vaccine derived virus is still looming on us, and the resurgence of resurgence of the virus in few countries really raises a concern. So today, just to be brief on the communication angle, I will just try to focus on that particular aspect of the polio vaccination. As you know, India is a very, very vast country. It is as good as a continent, if you see. And we have different type of ethnic groups, different type of geopolitical situation inside the one country itself. So regarding the communication and the vaccine acceptance, there are few factors where the communication or factors or the areas we can broadly say where the communication should focus. That is the experience from the polio days, and I think it still holds good for any other vaccination program in the country, and maybe in other countries across the globe also. So the first thing is that simple ignorance. Ignorance means they don't know about what is vaccination or what is polio vaccine, and some remote areas, some illiterate pockets, we have seen that it is just a simple ignorance. And communication, effective communication can be built around that, and it is easier to tackle. The second aspect or the second phenomena, which is just like they don't care. It is not part of their lifestyle. They don't go for the modern treatment. Either it is vaccination or accepting the modern medicine. They more or less believe on their traditional way of life and follow that. So it is not ignorance. They know that something may be there, but they don't usually practice that. So it is some sort of, it is not part of their life to accept the vaccine or any other treatment. So that is another group, may not be a large one, but still it exists. And as I have told that these two groups of population, ignorance and part of life, it is easier to deal with the effective communication. Once you communicate properly, it is easier. They accept it. Not much of difficulty. But then comes the other spectrum of the community where you have 2-3 areas. One thing is that the fear, a group of people who are afraid. Then another group of people who doesn't have the faith on the program or the vaccine or the medicine, whatever you are giving. So that is another fourth group. And the fifth group is they don't accept as a resentment of some other healthcare activities or health system, some sort of a protest against the health system, the other healthcare delivery or other things. I will just tell you 3 different incidences. Maybe that will help me elaborate these areas, which, as I have told, the first 2 things are easier to tackle, so I am not going into the depth of that. But the remaining these 3 areas, that is, the first one is fear, the second one is lack of faith, on vaccine or the medicine, and the third one is that they don't accept to express their resentment for some sort of a surrogate resistance for some other unpleasant displeasure of the health system delivery. So the first one, the fear. There was a large chunk of population who were really afraid. There was rumors that this type of vaccines may be acting as a birth control thing or some other sort of like putting HIV/AIDS into the community. So those type of rumors, and some group of people were really afraid. So if you can deal with them with the good communication, it is not impossible. And our polio program in India have dealt it with quite a successful strategy, and those fears could be mitigated. So this type of, that is the third group who are afraid. Then the fourth group who are not having faith, I can tell you about that. This type of people are more visible in the educated group, in the urban areas, well-to-do areas, in high rises, and they are not the rural or illiterate or poor group of people. It is just the reverse. That highly literate. I can remember, it was a very urban area around Mumbai, and I was in a multi-storied building. It is a high-rise, affluent society, and there in one apartment they were not accepting the vaccine. And when I went personally and discussed with them, it turned out to be a house where the in-laws, they were staying in other place, but the in-laws, they were doctors, and they were closely associated with the polio program. But the in-law, that the daughter-in-law, was refusing to vaccinate the small child with the faith that they had the idea that the vaccine available in the public health system, which is coming for free, they are not of good quality. So they were rather thinking that this is a quality issue. Anything available with the government, they don't take care of the quality of the vaccine, and this vaccine is not the right one to be administered. So they knew a lot, and that's why they had some sort of resistance or hesitancy to accept this vaccine. Then when I could manage to speak over phone with the father-in-law, who was himself a doctor in some other part of the country, and he was closely associated with the polio program even. Then when I discussed the issue with him, then they agreed, and the child got the vaccine. So that is another group. And very recently, I had another story outskirts of Delhi, and one of my colleagues faced the similar sort of incidents from a very affluent society, very well-to-do, very literate society. So that is another kind of acceptance problem, which is maybe difficult to deal with the communication unless you have to be very scientifically prepared with all the scientific justification to deal with that. And the fifth one, that is where they use the hesitancy or resistance to accept the vaccination as a resentment for some other health system issues. Again, in one of the slum areas, or peri-urban slum areas, I was into, and the child family was not accepting the vaccine. When I called the child's father, he is a young chap of around 30 years. I took him aside and told that, do you really believe that giving this vaccine will make your son impotent, or it is a birth control sort of thing? So he told, no, sir, I know it very well. It is not like that. But when I go to the hospital, they make me stand in the queue for hours together, and then you give just 2 tablets for fever and other things, and then you ask me to come again after 2 days. So there you deal with me in a very poor way. And now you have come to my house, so I am also utilizing this opportunity to prove my value, that this is a way of protest, that I am not going to accept the vaccination. So that is another group. So these are the things I just wanted to touch upon. Based on the real life stories, you can see that how these small incidents presented as a story can clarify the different types of behavior in the community related to the vaccine acceptance. So with that, I will stop and pass over to Pramod. And any questions I will be happy to take after the session. Thank you very much.
Thank you, Dr. Ganguly, for taking us through the enablers and challenges for the polio vaccine acceptance. So we must have noticed that Dr. Ganguly has bring the effective communication and the storytelling aspect. So we would like to, we will be talking more about the storytelling aspect for the vaccination journey through our next speaker. Can we have a slide of next speaker, please? So we have Amish Talele. She's a registered staff nurse and medical surgery unit at NYP. And she also co-chair of Nursing Communication Committee and 2021 Nursing Excellence Award, and she is a vaccine champion. So I request Amish Talele to share her vaccination journey through storytelling. Thank you.
Good morning. Thank you so much. Good morning, everyone. It's such an honor to have the opportunity to share my voice with each of you today. Thank you so much to Rita for inviting me and to each of you for joining. My name is Amy Saley, and I have the greatest job in the world. I am a registered nurse. I currently work as an orthopedic trauma nurse at New York Presbyterian Hospital, Weill Cornell Medical Center in New York City. I am also a graduate student at Columbia University, co-chair of the Nursing Now Challengers Committee, America's region, and an immunization advocacy champion. And I am so thrilled to be here with each of you today to speak about the future of healthcare. Before this pandemic, I defined communication as sitting down with another individual. It wasn't until the simplicity of sitting down and speaking with another human being in person was taken away from us that I realized that communication and advocacy really require only one single thing: a voice. A voice, a tweet, a quote, or a promise. Imagine that. The ability to impact an entire nation begins with one single verse: the courage to begin. Last year, Nursing Now and the Sabin Vaccine Institute launched a global solutions initiative to increase vaccination acceptance and adherence. Applicants were invited to submit an idea or proposal and were selected as winners and were granted a professional storytelling course with People Power Health, a monetary prize to launch their initiative, and the opportunity to share their stories publicly at the ICN Congress in November of 2021. So I applied for this vaccine equity and acceptance initiative for a variety of different reasons. Back in August of 2020, I had the opportunity to assist in a Florida hotspot. I traveled down there with 11 other nurses from my job to assist with some of the sickest patients that I've ever cared for in my life. And it was really such a rewarding and humbling experience. And this was back before we knew of any COVID vaccine creation in the works. And during one shift, a FEMA disaster nurse and I were talking about the possibility of a COVID vaccine. And I'm an optimist, so I said, you know, it's going to happen in no time. There's going to be this miracle drug. It's going to help everybody. And she said, a COVID vaccine really sounds like a Christmas miracle for you. So I returned back to my job in New York, and a few months later on Christmas Eve, I was working night shift in my job. Everything kind of quieted down. I settled into my chair to chart, and the phone rang, and it was the emergency room, and they said, the COVID vaccine is here and it's your turn. And I said, oh my goodness, this is literally my Christmas miracle. And then about a week later, I had the opportunity to join the vaccination team at my hospital and vaccinate some of my colleagues and community and the same people who I literally watched save my neighbors and friends and patients. And it was really just the most incredible way to say thank you. And of course, I had to share this with my found friend from Florida. So I snapped a picture of my vaccine card and I texted it to her and I said, Santa came early this year. And I didn't hear back, but I knew she had a 6-month-old baby. So I assumed they were just enjoying the holidays together. And I waited a few weeks and I still hadn't heard back from her. And I ended up coming across her obituary online and realizing that she had passed away before she could receive this vaccine herself. So there were many prominent moments which drove me to submit my application, but those were just a few. And so I was lucky enough to win this initiative alongside 6 other nurses from fellow nations who are really just the most inspiring and incredible people. And they really have influenced individuals, not only in their own communities and countries, but other countries and my country as well. So my specific initiative, Frontline Friends, targets low-income communities due to the disadvantages that they face when it comes to getting the right education and resources regarding COVID-19 vaccines. I created informational flyers, which include both vaccine information and vaccine sites throughout New York City. The first organization that I distributed to is called the New York Foundling, and it's one of the largest and oldest adoption agencies in New York City. This place is very close to my heart because I worked for the Foundling with pregnant teens in foster care prior to becoming a nurse. And I always say that before I became Nurse Amy, I was Miss Amy because that's how all of the children had referred to me. And while being a nurse is one of my greatest accomplishments, I always say that the title of Miss Amy is just as significant. When I delivered these vaccination kits, I had the opportunity to sit down with the CEO, who informed me that only about 60% of direct support professionals throughout New York are vaccinated. So I'm currently in the works of discovering new creative ways to get more of them vaccinated as well for COVID. The second organization that I worked with is the Alliance for Positive Change, which runs several harm reduction centers throughout New York City. It was brought to my attention by an individual facing housing insecurity that it's very difficult for them to obtain accurate information surrounding COVID vaccines. So I was really grateful to have the opportunity to assist this population as well. So you have heard my voice and my story, but before I leave each of you here today, because I am a leader of the Nursing Now Challengers Committee, and I am sharing a room with some of the best healthcare workers in the world, I'd like to leave each of you here today with your very own challenge. First, I'd like to challenge you to find joy in your work. While it is such a challenging time to be a healthcare worker, I'd argue that it's also one of the best times to work in the medical field. Quarantine and COVID taught us that so many of us attach who we are to what we do. And since we're still lucky enough to share this virtual space together, we should find joy and spread it. Second, if you see something kind in someone else, speak it. Over the past 10 months, my voice has traveled through over 150 countries at worldwide events, and it's really all because of the individuals who have amplified my voice. The effect that you have on others is really the most valuable currency there is, and we should always remember that. And lastly, but most importantly, use your voice for anything that sparks your enthusiasm, drives you out of silence, and motivates you to change something. It doesn't have to be a global initiative or a worldwide campaign. It can be anything that we want it to be, because the future of healthcare belongs to each of us here in this room today. I look forward to watching all of the amazing things that you do. Thank you guys so much for having me. And if you have any questions, please feel welcome to reach out at any time.
Thank you so much, Amy. It's great to listen, the challenges you have thrown to all the participants and bringing in the concept of the voice. So I think all must take a note of this, and they will accept the challenge and take it forward. So beyond storytelling, when we have a one-on-one conversation with the beneficiary, and the importance of trust, bonding, transparency, and behavior change processes are important key factors. On this note, we have our next presenter. Somehow we have need to record it because her unstable network. So we have RitaAkiki. She's a registered nurse with more than 20 years of experience. She's a certified leadership for change, from International Council of Nurses, and she has been advocate for children vaccination against preventable communicable disease. So I request MG to please play the recorded session, and we have Rita over here. If you have any question or any queries, we can get back to her in the later part of Q&A session. Please, MG, please. Thank you.
Good afternoon. I'm honored to share with you the importance of effective communication, especially the interpersonal skills of healthcare workers to enhance polio vaccine acceptance. The good interpersonal communication skills of the healthcare workers responsible for polio vaccinations can mean the difference between a child getting fully vaccinated or not at all. The nurturing of those communication skills aim to address the parents' concerns as well as building trust between the community and the healthcare workers. Building a positive relationship with caregivers, with parents, with community members is crucial to enhance the vaccine acceptance and to eradicate polio and to be safe as adults as well as children. The objectives of this webinar is to boost polio vaccine acceptance and to build interpersonal communication skills to attain a high level of vaccination. Healthcare workers are the primary source of information about immunization for the caregivers. So they need to build trust by communicating with transparency about the vaccine material containing either weakened or even inactivated microorganisms, the safety of the vaccine, and the most important, the high risk if the person is not vaccinated. Also, the behavior of the healthcare worker should be consistent with the ask for vaccination. If I want the people to be vaccinated, I need to be vaccinated as well as my family. The interest in others' goals and aspirations for a good health and for the reduction of children mortality is a major concern. To understand the vaccine hesitancy and the parents that need to be as good parents, so they have lots of questions, lots of concerns. They need to be listened. They need to have answers and clear answers. The healthcare worker needs to take responsibility. As healthcare workers, we need to speak with the people, to tell them about the cold chain, about the procedures used to have a good vaccine at the end users, about the safety of those vaccines. Healthcare frontliners need to be perceived by the community, especially by parents and children, as not willing to do anything that will harm this community. Also, they have to accept the vulnerability and the risk that is taken by this community regarding the healthcare worker behavior. So how we can cross from hesitancy and refusal to vaccine acceptance? This behavior change is a whole process and it is not a quick change. Multiple determinants intervene and influence on those changes. Healthcare workers need to repeat, to remind, to support families, also to adapt to their needs. Sometimes healthcare workers need to change their agenda to fulfill what the population needs. Also, it is not only fear from vaccine that is guiding this population. There is also lots of concerns for the parents, like not being able to attain the vaccine locality. Sometimes they do not know what is their problem. So we need to guide them as healthcare workers in order to attain our objectives. Also, sometimes the children are afraid from getting harm. They are afraid from pain. Sometimes it is a cost high cost, like in Lebanon. If we take the example of the HPV vaccine, a family that want to give her girl an HPV vaccine need to have a budget around $400. Compared to the income of this family, monthly income, it is 4 times higher the monthly income of this family. So how can they get this vaccine? So even policies should be adapted to the need of the population. Also, it is the behavior of the sense of the vaccine preventable communicable disease. What we saw in COVID, I'm young, I am not beatable, so I can overcome COVID. I do not need to be vaccinated. We was hearing a lot of those speeches. At this level of behavior change, we need to walk the talk and to go through the journey of the parents, to learn them about the vaccine, to get them the answers they need, to decide with them, to allow them to consult periodically, and also to deal with side effects, and of course to speak about the safety of the vaccine and the danger of the non-vaccine. Also, the emotions are very important when we are dealing with interpersonal communication. We all know that a human makes decisions based on emotions, on facts, and on perceptions. So the interpersonal communications need to use emotions added to the facts. Like, take an example. If I imagine that a child needs to be vaccinated and I am speaking with his mother, when I tell them the risks are 1 for 10 million, it is not like I am telling her the risk of the side effect of the vaccine is 0.00001%. So here she can sense less risky than the 1 for million. So it is important to work on the emotions. Also, the body language is important. So when I am practicing the active listening and I am looking in the eye with respect to this person, when the parents sense that we want to hear them, that when the dialogue with others is one-to-one, and it is like in the community everybody can speak up, we can use also the open communication. The non-verbal communication is important, but also the verbal communication, like letting the parents tell what they want by asking them open-ended questions. How do you feel about that? Also by reflecting back what they have told, like, so you are worried about this or that. Don't be worried about the fever. We are here to support you. This support is very helpful to convince parents to get their children vaccinated. So as conclusion, we can say that it is a major part of the vaccine campaign to have healthcare workers very well trained in the interpersonal communication, so they can approach the community, they can approach the parents, and even they can approach the children and convince all of them to get polio vaccine. And like this, we can have a raise in the immunization status in the community, and also in the ownership of the health of this community, and we can together eradicate polio. And thank you.
Thank you, Rita, for this brilliant talk. You have touched upon the very importance of the interpersonal skill through various models, through various dimensions, and you have touched all the aspects of interpersonal communication skill. So I would like to thank Rita for this brilliant video. Now, quickly switching to the next speaker, This is actually a recorded conversation which Dr. Pamela Besong had done with one of the community health worker, Mr. Peter. And this is the real grassroots experience which he had shared with Dr. Pamela. So there might be some background noises. So please excuse us for those noises which have come during the recording. So I would like request to MJ to please, start the recording. Yeah, thank you.
Okay, thank you very much, Mr. Peter. Welcome for this session. We actually have a presentation that we want to do on effective communication for polio acceptance, to understand how we can communicate effectively for polio vaccination acceptance. You were recommended to me by your Chief of Health Area, Madame Mokwe Marie. So thank you for coming.
Thank you. Good afternoon.
Thank you very much. So I want to begin by asking, what are the essential messages on polio vaccination that you usually share during campaign and during routine?
Yes, the message I always give my people in the community. First of all, make you to understand that my community people, they have trust in me, because I've been working with them for more than 7 to 12 years. So they have trust in me. When I come to the community, when I tell them something, they always believe in me. For example, I can say the last COVID-19, there are people in the community who believe and there are people who do not believe. Some people say they are tired with these our things, they are reluctant with the government. But when after that came to the polio. When we came there, I was doing the marking. I didn't have posters. I've been in the community. They asked me that is what I say 0 to 5 years, polio 0 to 5 years. Okay. So the only message I can tell you now is that for me, some people will say, you people have come again without your team. But in my community, they trust me.
Thank you very much. You've mentioned several elements. You mentioned to us that first, the fact that the community trusts you helps to improve the acceptance in the community. And also, you also spoke about posters. In using posters, they're able to understand what the intervention is about.
And they ask me questions.
Okay. Can you share with us some of these questions that they ask and how you answer?
I know the way I always, when I come to the community, I know the way I always talk to my people in the quartier. I can come and meet a mother. Maybe she's inside the kitchen. I'll just come and say, hey, Mommy, chop done. They will say, today on our wait. I'll just tell her that no, today is just polio, 0 to 5 years. You understand me now? It depends the way when I approach somebody. I have a sweet talk when I meet them and I talk to them and they understand to me.
So the approach also is a motivating factor for acceptance.
Yes. When I just say anything, they just ask me, say, Pro, do I today na wait? I'll just explain everything to them,
Okay, so this is done during campaign. But do you carry out messages for polio uptake during routine vaccination? Routine like day-to-day vaccination in the health facility?
Yes.
Like health talks?
Yeah, like only for polio?
Yes, let's just say polio because we're focusing
on polio now. Yes. Yes. You want me to give the names?
Well, can you just give me a scenario, what you actually do?
No, for me, I always tell them, I know that before the vaccine, you have 0 polio, you have BCG, you have Penta, Rota, Nemo, you have vitamin A, measles and yellow fever. So I always explain to them.
You explain to them. What do you explain? For example, polio. Let's take an example, polio. Yes. What do you really explain about polio?
I explain about polio that polio is good for their children. If they don't take, can paralyze them.
Okay.
And even vitamin A, supposed to take vitamin A.
Okay.
Yes.
Okay. Thank you very much. So you explain to them the consequences
Yes, if they don't take
of the disease, yes, the
if they don't
consequences of not taking
it.
And it also motivates them.
Yes, to take.
Have you ever had refusal cases?
Except one who refused last time in Mangakwata. He refused, but the next day when I was passing, the father called me. He says, what? I said, polio. He said, polio for what? I said, for little children. She called the mother, the child. Then she bring, then the mother of the child, then she used to bring the child and they give her the child polio. For this last campaign.
You've not had nobody who has ever refused?
Inside my canteen.
Wow.
If you want to believe me, send people behind me.
No, I know because your COC recommended you, yes. So which means that it's by excellence.
Yes, inside my community where I work. But I'm working, I've touched all the 9 communities.
Yes. Okay.
But inside my own community, go there, you have 100%.
Okay. For the other communities who refused, maybe when you go there, one or
no,
two.
It's just like the last campaign. I work with 2 communities. I work 2 communities.
Were there any refusals during the last campaign?
Let me check whether there was a refusal. I don't believe. Because the other community, let me check. No, I didn't have any refusal. Okay. I didn't have any refusal in the other community.
Okay. We are looking at ways in which we can improve polio vaccination uptake. I know that now you people are doing social mobilization. Yes. So what are the messages you're telling them this time to increase?
Yes, I'm telling them now that they should. I mean, from my people in my part that are already waiting, I've already made them to know that this Friday we are coming for the second phase. Okay. And they're prepared.
Okay.
Yes.
In some other
because I told them that not only coming there, but we are going to share them aqua taps.
Okay. Which is a motivating factor.
Yes. I told them. So they see us in the community, they know we are coming from polio and aqua taps to share, to fight against cholera.
Can you share with me some of the reasons why people refuse the polio vaccine?
For the reason, it's because of the COVID-19. Okay. Because of the COVID-19, so some people are afraid. So I had to convince them in my own community.
By telling them what kind of messages, can you tell me a little?
No, I tell them that COVID-19 has come and gone. Now we are having the polio, and this is for little children.
Okay. Why polio? Why COVID is for?
It's for the elderly people.
Okay. Thank you very much for sharing your ideas with us. It will really be helpful in sharing with other community health workers what strategies they can use to improve the uptake of polio in their community.
The strategy. We are talking of the mobilizers to improve the polio.
No, I'm saying that thank you so much for your time because it will help us to share with other people how to overcome these challenges in terms of polio. So I'm very happy for your outcome.
Thank you.
Okay. Bye.
Bye.
So yeah, it's a great to listen from the grassroots experience from Mr. Peter for some of the enablers and barriers and how he has come over with some of the issues. Now I think we are open to Q&A session. We are actually running out of time. So I think 7 to 8 minutes would be suffice. It's not only the Q&A session. You can share your thoughts, views, anything which you like to share. Anything you want to contribute on this webinar. So yeah, we are open to anything whatever you want to share with us. Yeah. You can unmute your speaker and can share whatever you want to share with us. And if you have any questions, queries to any of speaker who you would like to hear more about anything, you can please address to that speaker.
Well, Pramod, it seems like everyone in every country for vaccination, we have same problems. Since from India, from Lebanon, all the countries, we are sharing same issues. I think we have to plan for a worldwide action plan that can involve everybody, so we can at least have a better vaccination for us and for the next generation. It could be amazing. We can use Boost community platform and launch this plan. What do you think?
Yeah. It would be a great initiative. We already been part of a community, Boost community member, and we will be sharing more reflection on that part as well in the later part of this presentation. So yeah, that would be a great, suggestion for all of us as a immunization health professional. Yeah.
There was a raised hand. Stephen is who I saw.
Okay, thank you so much for the opportunity. Listening through the stories, the storytelling, and I think the video has even just gotten me down, looking at the community of worker with his day-to-day activity. There's this thing I have learned around with community health work. It's like he said, winning their heart. And winning their heart doesn't mean the number of years you have stayed with them. It depends on how you approach them. So we always have this thing in nursing, which I always love, rapport creation. How do you create a rapport? How do you make them feel like you are part of them? So if you are not doing this as health workers, then we will always lose touch with the ground. So let's say polio or any other vaccination that we are carrying out. If you don't go with good communication skills, the interpersonal communications, whether inter or intra, at least you yourself, you have to psych yourself before going. Getting to the community, you should know probably where you were raised up or the kind of geolocation where you have always found yourself, way of doing things might not be similar like the new environment you are going in. And you should understand that their way of life is so different. So you should be able to put yourself into their shoes. You should be able to find a way of being with them and understanding them. Then now anything that you are going to say, they will pick it up. So it's not about being there with them for a longer period, like our last video said, but I feel good rapport creation, create a good rapport, create a good nibbling environment, let a person feel comfortable. Like food, I've learned one pidgin from Cameroon today, food don't dawn. Meaning, at least I want to find myself in there. Oh, I'm happy. Is the food ready? Am I part? Did you add my name into it? Do I have my mouth in there? Today, I feel like staying with the community for long. I want to be in your house. Let's discuss. Then I think we can get a long way for them to accept whatever intervention we are bringing to them. Not just vaccine alone. Any intervention or strategy that we have to help improve health can be done through communication. And it all has to start with a good rapport creation. Thank you.
Thank you, Stefan. You are right. I think we have Smaila. He has his hands up. You can go ahead. Smaila.
Okay, good afternoon. Hello, good afternoon. Am I audible enough?
Yes, yes. Good afternoon.
Yes, you are audible. Thank you.
Yeah, it's good to be here, and I want to commend all the presenters for a wonderful presentation. What I want to add here, just to the last person that contributed, you know that in effective communication for community activation, we have 3 major important strategies that we adopt, one of which is story of self, story of us, and then the story of now, where you as the communicator, as you are going to the community, you must have getting yourself armed with all the necessary information you need regarding yourself, and then what you intend to do. Why do you want to do what you want to do? Why do you want to communicate the way you want to communicate? Which means you are ready. And then the story of us entails the people you want to go and change their behavior regarding vaccine hesitancy. Now, what do? You have to know your people, identify them, identify what they like, what they don't like, what are the reasons for refusing that vaccination, and then their culture, their religion, their location. All these things must be in place before you embark on that particular journey. And while there, the story of now tries to entail what action do you want the people to take alongside with you to ensure that that particular problem is taken care of. That is, if you leave, what is the action? What are you leaving as an imprint in their mind? So that even in your absence, even when you leave that region, those people can be able to continue that activity, even in your absence, so that it will not be something that it is done today, tomorrow it is left, but it's something that you left in the people, so that tomorrow they can be able to continue taking care of that activities, and then that mistake that has been done in the past cannot be repeated. And then lastly, what I want to say is that effective communication is not limited to when it's horizontal and vertical. That's what I want to say. That is to say, as a communicator, as you are going to the field, you also know that you have people that you are working with. Those people have different skills and talents that you take along, and you recruit people based on what they will contribute to your communication as you are going to the field. Because communication in the field is not a one-person activity, except where you find yourself alone. But if you have a team, you must identify who and who in your team can be able to take care of different aspects of the communication process that you want to go and embark on. So thank you very much for the opportunity. Over and out.
Thank you, Ismaila. I don't know if there are some comments that have been written in the chat. Pramod, are you able to read them out?
So I think we have some chats from Lizzie and Judith. So if you want to share, Lizzie and Judith, if you want to share your thoughts, you can unmute yourself and can share with us. We have still a couple of minutes over here. Dr. Sikandar has also shared something, so I don't know if he's available. He can also share his thoughts. He can also contribute.
I think Lizzie's hand is raised. Though.
Lizzie's hand is raised. Lizzie, you can go ahead. Thank you.
Thank you very much. And good afternoon, everybody. I'm Lizzie Iwine from NEWAFA. NEWAFA is Nigerian Women Agro-Allied Farmers Association. We work in the communities, and we know that if you really want to work with a community, you have to come down to their level. You have to translate your communication in their local language, and you have to liaise with the local communities if you want them to open up. So we should have this in our mind and factor it in. From our locality in West Africa, in Nigeria, we really need to work with our people in our local languages. Thank you very much.
Thank you, Lizzie. Thank you so much for your comments. MJ, can we have, since we are running out of time, can we have a last slide? So yeah, so we are about to close this webinar, and I would like to leave you one take-home thought. Since we have been using the 4 skills which I have mentioned in the presentation, the storytelling, mentorship, and relation building and leadership, what do you feel the effective communication is a good fit for all of this skill, or whether you will go for one of or 2 of these skills? So we have a Boost community member. So if you'd like to learn more about these skills, brush up your skills around these immunization day-to-day skills. So I would request you to join the Boost community membership. Can we have a next slide, please? So yeah, you can visit or join the Boost community. So it's basically immunization professional, where we connect to learn and to lead some of the capacity building initiatives. You can take advantage of the online platform, including the online courses, live workshop, and webinars. You can also join the community activation group, like we have this series under this activation group only. You can also join the Boost Telegram channel, and we will be reaching out to you for a survey. Next slide, please. MJ, can you take this presentation?
Great, thanks, Pramod. And I just want to thank all of our presenters today. What we probably didn't mention at the beginning is this whole team has put in 14, 15 weeks of great work in our Boost Fellowship program. And this webinar is kind of the culmination of all their great work and learnings that they've been doing over the past few months. So they are Boost champions, and this is kind of laying out the journey and how they got here. So if you're an immunization professional and you're interested in kind of being in this position, this is kind of the step learning journey that you can take a part in when you join the Boost community. So we have 2 self-paced courses, one on storytelling. We open a cohort about twice a year. So we just closed out our summer cohort, but we do hope to launch again in the fall. So please keep an eye out. We do provide that course in English and French. We also have one called Discover Your Leadership Moment that focuses on adaptive leadership. Both those self-paced courses make you eligible for our 6-week-long Boosting Leadership to Activate Communities, which is a very interactive course that combines both these topics of public narrative, community building, and leadership development, adaptive leadership. And then those participants then become eligible for our more advanced trainings, like our Boost Champions are a part of today. So if you have more questions, please reach out to info@Boost, and we're happy to kind of guide you through that. But in the meantime, we do have some ongoing initiatives that you all can get a part of or become a part of today. So we do have our Behavioral Science Immunization Network. There's a learning group you can request to join on the Boost platform. Additionally, for more COVID-19 resources, we have our ongoing COVID-19 listening and learning series, and we just released a new episode for our podcast. And then, as I mentioned, Storytelling for Change, that registration unfortunately has closed. But if you are interested, please email us and we can make sure to get you that information when new information becomes available. And then we also have our Insights Dialogue Initiative, which takes a close look at the influence of social media on behavior change and specifically around immunization. So I know that there's probably a lot of links that you guys need, but we will be following up in an email all of these resources and how you can get involved. So please look for that email in your inbox in the next day or so, which will include this presentation and all of the affiliated recordings. But just once again, want to thank everyone for joining today and for our amazing Boost champions for this presentation. But Pramod, back to you for any last closing words.
So I think we are right at the time. We are 6:31 and we are good to go with one photograph. I request everyone to please open your video so that we can have a group photograph, and I think Brian would be helping on that part. So I request everyone to please open your video so that we can have one group photograph for this webinar. Thank you.